Hello, and welcome to Conversations from the World of Allergy, a podcast produced by the American Academy of Allergy, Asthma, and Immunology. I'm your host, Dave Stukas. I'm a board-certified allergist and immunologist and serve as the social media medical editor for the Academy. Our podcast series will use different formats to interview thought leaders from the world of allergy and immunology. This podcast is not intended to provide any individual medical advice to our listeners. We do hope that our conversations provide evidence-based information. Any questions pertaining to one's own health should always be discussed with their personal physician. The Find an Allergist search engine on the Academy website is a useful tool to locate a listing of board-certified allergists in your area. Finally, use of this audio program is subject to the American Academy of Allergy, Asthma, and Immunology Terms of Use Agreement, which you can find at www.AAAAI.org. Today's edition of our Conversations from the World of Allergy podcast series is targeted towards both healthcare professionals and also really the general public. And we're going to talk about a really cool tool on the Academy's website that I think a lot of people are going to find useful. And to help us discuss that, we're happy to welcome today's guest, Dr. Olga Kagan. Dr. Kagan is a healthcare consultant and an adjunct associate professor at the Cooney School of Professional Studies and Malloy University in Long Island, New York. Dr. Kagan has a fascinating background, which we're going to learn about, as a registered nurse with interest in anaphylaxis, informatics, education, health policy, and research. She served as the lead faculty for the new AAAAI online education course designed for patients to learn more about anaphylaxis. And with that, Dr. Kagan, thank you so much for taking time to join us, and welcome to the podcast.
Thank you for having me.
Yeah, I think this is
Olga,
going to...
by the way.
Cool. Olga? Okay, you got it, Olga. Thank you. Well, we're excited to have you. And before we get into this really exciting new tool for our patients and the general public, I'd really like to learn more about your very interesting background. Would you mind just walking us through your path, how you became a registered nurse, and also you obtained your PhD? Tell us more.
Thanks for asking. I've been a nurse since the mid-90s. I actually got my initial nursing degree back in the former USSR, one of the former republics known as Uzbekistan. And I actually wanted to be a special education teacher when I was younger, just like my mother was. But since I was 13, I sort of ended up being the caregiver in my family with my grandmother's insulin administration on a daily basis, and then giving IM injections to family members, massage therapy. It's just like, for some reason, I ended up pursuing, path of healthcare. And I think it turned out pretty well, because today I'm sort of fulfilled in a way, because I'm not only a nurse, but I'm also an educator. So for me, that was ultimately, I got to where I wanted to be, maybe not in a school setting, but certainly with patients, when I get to educate them and take care of them and take care of our nursing profession as well.
What did you obtain your PhD in? What was your thesis?
Oh, that's actually kind of interesting. So I didn't get into, it was in willingness and readiness to act in a food allergic emergency on the college campus, because at the time, there was a focus on policy, trying to kind of change the way we train people and stock epi in public places. So for me, it was important that, just like Narcan is widely available for drug overdose, and it was really my goal that we have similarly epinephrine available to individuals in public spaces. And college at the time was the area that I was sort of interested in. But prior to that, I actually had experiences in critical care, and also worked in the World Trade Center. It's a worker and volunteer medical screening and monitoring program at the Mount Sinai School of, it's called Selikov Center for Occupational Health, actually. And there, post 9/11, we received a grant to build this program to see workers and volunteers who worked at Ground Zero. And I tell you, at the time, we had such large amounts of data that we collected, and we did it by hand. And at that time, I realized, I said, well, there has to be a better way. And that sort of kind of led me to this path of, as we started implementing EMRs, and it kind of sparked my interest in informatics and research. So, because part of that was also data collection and, showing what are the trends in terms of the disease and post 9/11 related health concerns. And I know this program is still up and running today, so it's kind of interesting. It was one of my babies that I built with a group of individuals at that time working at Mount Sinai. So it's sort of, that's where all my passions kind of aligned, with the technology, informatics, and then, of course, my interest in anaphylaxis.
Like many of our friends and colleagues and guests on the podcast, you seem like somebody who doesn't say no very often. Is that an accurate assessment?
You nailed it. Yes. I have a hard time saying no. That's true. That's very true.
You seem to wear, as you have already described, you have many different hats that you wear. Can you tell us about kind of what you do, now in your day-to-day roles as a consultant and also a faculty member at your university?
So as a consultant, so I actually have a pretty diverse client base. I work with startups that look for clinical expertise, somebody who's a nurse or a physician to provide or inform their solutions to the problems that they're trying to solve. I also do some pro bono work for non-for-profit organizations like the homeless shelters. Like, for instance, I work with shelters with single moms who, typically don't have exposure to healthcare professionals to the extent that others may have. Also, school districts, community-based organizations, faith-based organizations that don't typically hire physicians or nurses, but they do deal with children, and they want to be prepared or be equipped in addressing allergic emergencies or just healthcare emergencies in general. And interestingly, more recently, I've been getting more requests from the private sector, like things like bank chains who are looking to really change the culture of, among their colleagues in terms of inclusivity, understanding its food sensitivities and how to be accommodating and inclusive of those employers. So that was kind of refreshing to see. And as far as my teaching, I teach two graduate programs in New York. One is in Long Island, one is in New York City. And one of them is completely a synchronous online program with the City University of New York School of Professional Studies, where I primarily teach in the informatics track, nursing informatics. So that's been pretty rewarding. I have great colleagues and the students, so a lot of exciting things there.
Oh my gosh, you are involved in so many things. I was intrigued as I was looking you up to help prepare for the podcast, and you have the acronym CIMI that's listed after your name, which I had to look up because I had no idea what this meant. So, what led you to becoming a certified infant massage instructor, and how how have you used this?
Well, thanks for asking. I don't know if you can get this question, but there's actually a backstory to this. So when I got my initial nursing degree back in my home country, at the time, I also received my masseuse license back there. And I worked with actually babies, infants, infant massage. And because we had socialized medicine, every newborn was provided with about 10 sessions of wellness massage therapy, something that we don't see here in the United States, unfortunately. But we had, and of course, if children had any sort of health conditions like hip dysplasia or any sort of muscle tone or colics, etc., they would get more specialized and targeted massage therapy and other treatments. And so I really enjoyed that, and because there's just so many benefits, for mother, for the baby, the bonding experience, that reducing their stress, parental stress, anxiety, and even for moms, the postpartum depression was much lower. And of course, just just healthy connections that they form with their child and just kind of contribute to the well-being of their child. It really empowers parents. And of course, for babies, it kind of helps coordinate their developing circadian system with those environmental cues. It helps increase their blood circulation, that promotes the transport of oxygen, that also then protects their immune system against infections. It's just their body temperature is more regulated. It's just like so many benefits, and all of this are evidence-based, believe it or not. So I kind of, when I moved here, I said to myself, oh, I wish I could do this here. But of course, I didn't have the masseuse license. So I ended up getting the, certified as an infant massage instructor. So I can kind of carry this forward. But unfortunately, there's no market for this in this country unless you have a lot of money. And it's sort of a luxury here. And so right now it's reserved primarily for my family and friends. But of course, I hope one day it becomes something that we practice regularly.
That's really interesting. And yeah, that's something I was not familiar with at all. And we're going to get to, the main topic, anaphylaxis, in just a second, but I'd love to just ask about two more things that you're involved with. Can you describe the group that you helped co-found that's called Collaborative Healthcare Innovation Research and Problem Solving, which has the abbreviation CHIRPS? What is this?
So this is also something that actually evolved right before the COVID pandemic. Actually, I would say right on the cusp, right around that time of the COVID pandemic. So this group was initially formed informally in about 2020, I want to say. But it quickly became part of the non-for-profit organization called the Society of Nurse Scientists, Innovators, Entrepreneurs, and Leaders, which is SONSIEL for short. And that organization incorporated in 2019. And it really is something that meant for nurses, but also for nursing allies. And that this is for individuals who really are passionate about innovation, who want to develop solutions, who want to invent or redesign solutions to solve healthcare problems that they face in healthcare. And that's something that we try to empower and equip nurses with, some of the skills to do that. And we do that through nurse-led hackathons. You may have heard a hackathon, which is essentially an innovation sprint. And I guess the most famous one is the MIT, the Hacking Medicine event that you may have heard of. Mm-hmm. I know some other institutions are doing them now, Mayo Clinic, Stony Brook. I mean, I know a number of facilities that are pursuing that. Essentially, it's this innovation sprint that happens in a short period of time within usually like a 3-day weekend. And then by the end, those diverse teams come up with the solutions to the problems that they want to solve. And they develop what we call MVP, or minimally viable product. And they present it in front of the panel of judges that hopefully if they win, they get some type of funding or some type of mentorship to help bring that product to fruit. That we are now having for nurses through that organization. And we offer them things like design thinking workshops, innovation conferences, innovation certificate programs, just an array of different support tools that they can employ in order to, be able to innovate. Because I know nurses are very busy individuals and they're at the bedside and they're so exhausted and overworked, which I think is similar for physicians too. I feel like the burden that they experience since the COVID pandemic and now has been tremendous, but we are trying to give them that creative outlet so they're kind of alleviate some of the frustration they may have and be able to, feel like they're contributing to something important that helps them change some of the issues that they're facing every day. So it's a more pleasant environment to work in, and hopefully move the profession forward. So, and the group that we talked about, the CHIRPS, is one of the groups within that organization that basically focuses on more on the scientific end of it, trying to really understand why and how nurses innovate, how those hackathons, impact their career trajectory. So that's something that we do through that group.
Okay. Well, I really appreciate you sharing all of this, fascinating work that you've been involved with. One last thing that, ties in very nicely with today's topic. Tell us about the Food Allergy Nursing Interest Professional Group that you that you founded. What happens in this group and who can become a member?
Okay, so I'm really passionate about this particular group because it consists of actually registered nurses and advanced practice nurses. Some people may know it as APRNs. And these are the people who are interested in professional collaboration, advancement of knowledge, dissemination of knowledge in the subspecialties of food allergy and food-induced anaphylaxis. So we really, through that group, which I founded in 2019, we really are hoping to make an impact in having more allergy-informed nursing workforce and more specialized roles, like, for instance, allergy nurse educator or nurse navigator, that can help fulfill some of the needs where access to allergy specialty care might be minimal or lacking, especially in areas like the underserved communities or remote areas where it's difficult to even find, an allergist or a specialist. So it's sort of like being an extension of an allergist in that space where they can, and again, it's something that the role we have the vision for it. It hasn't been done yet, and maybe part of it could be telemedicine. We don't know, but it's something that we're hoping to one day have available. And I think with this, we can really optimize the resources and improve care delivery, and more specifically, the patient outcomes and their quality of life, because we know how devastating the diagnosis can be and how unpredictable anaphylaxis can be. So it's hopefully we can help those families. And anybody who's interested in joining the group, they can find us on LinkedIn. They can also contact me directly, and I'll be happy to get them onboarded. And it's right now, it's a growing group, and we we're working through some of the logistics of possibly making it something a little bit more inclusive of international community as well.
Oh, this is great. Well, speaking of anaphylaxis and speaking of providing education and reaching the underserved and the general public, anaphylaxis can be a really confusing term for both healthcare professionals and especially for patients. So let's start, help us out. What is anaphylaxis?
Well, you're right. It can be confusing, right? I kind of tried to put it in simple terms of anaphylaxis being as a severe, potentially life-threatening allergic reaction that could be triggered, when the immune system overreacts to usually a harmless substance, and it could cause mild to severe symptoms that affect various body systems. And I know that based on the 2023 anaphylaxis practice parameter update, we know that the World Allergy Organization and Brighton and Delphi consensus groups aiming to create more universally adopted definitions and criteria for anaphylactic reactions. So I think we'll see more in that.
Mm-hmm. So tell us more about the different severities of anaphylaxis, because when you talk to patient support groups and you see this information shared online, I think most people just automatically connect anaphylaxis means your throat's going to swell shut and you're going to die. So are there different severities of anaphylaxis? Can somebody just have a mild anaphylactic reaction?
Oh, absolutely. So it can start as mild, of course. Symptoms like maybe skin rash, maybe redness, itchiness. It could progress to more moderate anaphylaxis where we have more than one system involved. Maybe skin rash accompanied by, let's say, gastrointestinal symptoms. So yes, and then of course it could progress further to more severe reaction.
So when we educate our patients or the public about anaphylaxis, you mentioned, I think already a couple of times, the body systems. Tell us more, like what are some of the symptoms that can, present based upon what part of the body is affected during anaphylaxis?
Well, if we talk about, life-threatening anaphylaxis, for instance, when it's a more severe reaction, that could really involve a respiratory, cardiovascular, and neurological, body reactions. So, for instance, with respiratory, we can see development of difficulty breathing, swelling of the airways, and weak pulse, dizziness, that could all lead to anaphylaxis, of course. Then life-threatening anaphylaxis is when we start seeing people losing consciousness, being unable to breathe, may have poor perfusion to vital organs. And that is really a truly medical emergency that requires immediate medical interventions. And, again, it could be as mild as I mentioned earlier to as severe as basically shutting down the entire body. So does that answer your question?
Yeah, I think to dive a little deeper, what about so what are the more common for somebody with mild anaphylaxis? Are we watching somebody have, some hives and itching associated with, say, nausea and vomiting? Or what are some of the combinations that we typically see in those scenarios?
Right. So we could see, for instance, hives and accompanied by abdominal pain, vomiting. Yes, could be. We can also see, it's interesting because anaphylaxis is very unique to an individual. And so you're never going to see exact same presentation, even within the same person. Even they may be exposed to the same allergen over and over, but the reaction may vary every single time. It all depends on it. Also, there's a lot of other factors that go into it, whether the person has any sort of immunocompromised state at the time. Maybe they have a viral infection in addition to it. For girls, they may be menstruating, so the reaction might be different at that particular point in time. So there's just so many different variations. So you will never probably see the same reaction every single time when it comes to an allergic reaction.
Yeah, and that's a huge part of the challenge, right? I just yesterday, unfortunately, I had to administer epinephrine in the office setting. Everything was fine, but the parent quoted me. They said, "Why can't it be so easy as it's the same symptoms every time?" And I was like, that would be wonderful, right?
Yeah, I tell you, and that's part of the challenge. That's why it's so difficult sometimes for people to know. I'm like, well, but it doesn't look like it did last time, and so.
Yeah.
It kind of throws people off as to, what they even have to do. And is this real anaphylaxis? Or maybe I'm looking at something else. Maybe it's just food poisoning. It depends on the symptoms. It could be confusing.
Yeah. What have we learned about anaphylaxis in young children, especially infants and toddlers? Can they have sort of a different presentation, especially since they're not verbal?
Absolutely. So age-specific symptoms may differ, from infants and toddlers to older children and also adults, of course. However, the age alone is not in any way correlated with the severity of anaphylaxis. So, for example, if we have infants and young children, we typically see skin symptoms more often and respiratory symptoms less often, right, compared to older children or adults. And also we have to look at their developmental stage, how verbal or nonverbal they are at the time. Some will have limited vocabulary. The way they articulate things might be different from older children or adults. The behaviors they exhibit might be different. They may be fussy, they may be itching, they may be just, very uncomfortable. And we have to also differentiate, are they being, is it a colic, or, are they just having a lot of gas, or are they actually experiencing gastrointestinal symptoms related to an allergic reaction? So these are some of the variations that could be presenting the differences between the two groups.
Yeah, and you've already mentioned several times of just the overlap of the symptoms during anaphylaxis can be attributed to other causes as well. Is there anything that you kind of help when you do all your education, say you mentioned for the private sector and things like that, how can you differentiate anaphylaxis? Is there something like the person looks unwell or the acute onset of it, or give us some more tips along those lines?
Yes, so it's interesting because not every case, again, is the same. So sometimes people may not have any cutaneous symptoms. They may sometimes be going right for their airways. Actually, I don't know if I mentioned, one of my children has food allergies, and I remember she had a piece of pine nut, and within seconds she said to me, "Ma, something doesn't feel right. I feel like there's a crumpled piece of paper towel stuck in my throat." That's how she described it. And I said to myself, oh my God, I said, she is having an allergic anaphylactic reaction. And it was so severe that she got epinephrine right away. And within 10 minutes, we had her in the emergency room, and she had a biphasic reaction, which necessitated another dose. And her skin symptoms and GI symptoms didn't show up until 40 minutes later. So that was really interesting. So every presentation is different. So sometimes we may not have hives or itchiness right away. It may sometimes go right for the airway or cardiac compromise. So it depends on the severity, the exposure, the amount of exposure, and like we mentioned before, other factors that may play into the type of severity. So when we talk to patients, my goal is, I always tell them that if you suspect it's anaphylaxis, it's always better to err on the side of caution, because the harm, even if they inject epinephrine, there's really very minimal harm there. And I always bring example. I don't know if you probably remember that back in the day, before we had inhalers, we treated asthma with epinephrine. So just kind of putting it in that, framing it in that way, people are like, oh wow, okay, so just alleviate some of that anxiety. And I think they feel a little more comfortable knowing that even if they are suspecting anaphylaxis, that it's okay to treat it. So they're not going to, yeah, go ahead.
No, absolutely. So I was just going to ask you, so just to confirm, can you state clearly for our audience, which I'm sure they already know, but just in case they don't, what is the single best and most effective treatment for anaphylaxis, and when should we use it?
So epinephrine, most certainly. So at the moment, this is the only and most effective treatment that is recommended. However, I'm hopeful as we see more novel treatments and therapies that are being developed, that maybe in the future we'll have more options. But at the moment, epinephrine is the drug of choice.
Okay. What do we know about use of epinephrine for anaphylaxis in the pre-hospital and emergency setting? Is this something that everybody's getting? Is it being used consistently, or are there some gaps there?
Well, it's definitely being underused. And we know that from some of the studies that we've seen over the years, that the treatment, and it's interesting, it's underused both by patients and also by providers. So, some of the studies that I recall now is that, for instance, I forget, I think it was a 2012 study, but it was a while back, but it talked about that 30% of severe allergic reactions were treated with epinephrine. Only 30% were treated with epinephrine in children, preschool age children. And then about 2/3 of patients presenting to pediatric ER hadn't received epinephrine prior to their arrival. So that was, I want to say 2017 study. And then We also know that most cases of reported death from anaphylaxis have been associated with either lack of or delayed administration of epi. So it's so important that we have timely recognition and prompt treatment for it. And to me, these are the probably top two important factors in preventing severe allergic reactions. And we did talk about anaphylaxis being unpredictable. So I think we as clinicians have to be more proactive in educating our patients and caregivers so they can be familiar with the prevention and action strategies. Prevention strategies like being able to read labels, being able to ask questions if you're in a restaurant, advocate for yourself, set proper, measures for children entering school system to make sure that whoever is caring for them is well versed on how to deal with that condition. And of course, the action strategies of administering epi, activating EMS. So these are some of the things I think we have to do a little bit better on.
Mm-hmm.
So,
yeah, I was actually one of my questions for you is, this is such a difficult diagnosis and concept for a lot of folks, including our colleagues in the healthcare profession. Do we know anything about, is this education consistently being provided to all of our patients who are at risk of having anaphylaxis? And if not, what are some of the barriers? Why aren't we educating them? What can we do better?
I think as clinicians, we do best we can with the tools that we have, and also the constraints that, we might be surrounded by, like the time, the reimbursements, the availability of different educational training resources. Maybe it's the staffing, right? I'll be honest, when I see allergists in the large medical academic institutions, they've got a lot more support in terms of having skilled registered nurses on staff, having sometimes registered dietitians, having mental health professionals. So it's really a very cohesive and well-rounded team that can address patient education and all different aspects of it. Whereas sole practitioners sometimes don't have the same luxury to be able to hire a team like that. And so there's more burden on them to now provide all of that. It's sort of like you don't have that extra support, in other words, right? And so that makes it challenging. And also the tools, the tools we have, I'm always looking at, and one of the reasons we wanted to develop that tool is because, we're working with digital natives now. All these younger generations, they don't learn with handouts and brochures. And, if you give them one, I have a feeling they'll lose it, throw it on the way out. It's not something that that's intuitive to them and that they're used to. They grew up with technology. So I feel that we have to speak to them in that same language. So we have to offer it to them on the gadgets that they're used to, that they're naturally in tune to. And that's sort of kind of, that as an informatician too, that's where my mind is, that education nowadays has to be digitized so we can offer that to them at their fingerprints, their handheld devices, computers, etc.
Yeah, so you're describing TikTok, essentially.
Well, you know what? I wouldn't be surprised. There are actually some pretty interesting. I'm not on TikTok, but my daughter is pre-med, so she says, "Ma, there's a lot of interesting things." She follows a couple of people who have pretty interesting content. It's pretty accurate too. So I'm like, wow, impressive.
Yeah, that's a topic for another conversation. But you're right. We have good colleagues within the academy that are doing great work on social media that are trying to educate. But unfortunately, there's a lot of really bad stuff out there as well. But I digress. So do patients generally feel pretty confident in recognizing and treating anaphylaxis? I mean, I'm getting the sense that the answer is no, but
No, I tell you, especially the newly diagnosed patients, they don't feel confident or comfortable. No. And in fact, I think I want to say 5 or 6 years ago, there was another study that talked about the confidence in administering epi, and those who've done it 2 or more times felt more confident. So it's all about repetition, right? And even if symptoms vary, you kind of know, you start recognizing this, the more you do it, but hopefully they don't have to do it often. But for those people who experience anaphylaxis more frequently, they're a lot more in tune with their bodies and what to do. So, and again, it's not like, sometimes I compare it to diabetes, because in diabetes, people do it regularly every day. So they're used to that injection. And with anaphylaxis, you may not have a reaction for 10, 20 years. You may never have a reaction, but you still have to remember that skill. And so to remember that skill, you have to practice. And how do you practice? So it's, so these are some of the things that we have to sometimes keep in mind. And I'm in an area that's very diverse because, New York is a melting pot. So we've got other challenges here, language barriers. We've got cultural norms that may be different from, what we're used to. So we have to work with that as well. So.
No, I love your description, and I couldn't agree more. And it's one of the things, I mentioned the patient who I had to give epinephrine to. I often spin it and I say something along the lines of, congratulations, now you know what it feels like. You know what it feels like to have a reaction. You know what it feels like to receive epinephrine. You know what it feels like to improve after getting it. That's a powerful thing that you can walk around with now, and knowing that and having that confidence. So yeah, but you're right. Trying to educate somebody who may not need it for 10 years, oof, that's really hard to do.
Yeah, very difficult. And it's also, very nerve-wracking situation. So even if you do know it, sometimes when you're experiencing your child go through this traumatic experience as a parent, like I can't even imagine. I was a critical care nurse and my child had an allergic reaction. I doubted myself. I said, oh my God, what am I looking at? And so, well, the first time, of course, but, quickly, it was a quick study on that. But for patients who don't have health background and they see that, I can only imagine the amount of stress that they're feeling on what to do, and is this going to get worse? And it's just so much. So I can totally empathize with them, and my goal is always to put them at ease and provide ample practice opportunities. So I'm hoping that would be helpful to them.
Yeah, that's great. And it's not like anaphylaxis is ever at a convenient time, right? It's not, you're not just saying, all right, I think now's a good time for me to have a reaction. You're at social events or gatherings, or you're eating food, or you're at you're in a very comfortable situation usually, and all of a sudden your body has this very abnormal reaction, and it's very off-putting.
So true.
Well, yeah, let's talk about this great tool that you helped develop. So give us some background as to why the Academy developed this online tool to help patients better understand anaphylaxis.
So it was actually interesting. So during the COVID pandemic, when we had meetings on Zoom, so during one of the anaphylaxis committee's calls, and I believe it was Dr. Schiffler and some other individuals who kind of really were concerned that we still had this problem of underuse of epi during anaphylaxis. And so, of course, being that having my informatics hat on and having developed previous tools that are still some of them are still in the prototype stage, right away, I said to myself, well, because we probably are not talking to people in their language. So we have to offer it to them on a platform that they can relate to. And so that idea of developing this digital tool, Anaphylaxis Interactive Learning Guide, kind of was born at that time in response to some of the concerns that came through that committee. And of course, being part of the HIDE committee, I quickly realized that, we got to pull efforts together and do this together. And so we have, with that tool, we now have the potential to maybe improve education, right, for patients and caregivers. Another thing that really concerns me is that every time patient ends up in the hospital or the emergency room for this, the skyrocketing cost of healthcare. And I know some people do not want to go to emergency room because they don't want to pay that deductible, the copay. So if we can help reduce some of that cost as a result, that'd be also fantastic, right? So people will be less hesitant to go. And then help increase their self-efficacy and confidence level that we talked about earlier, improve their quality of life that we talked about earlier, that stress and fear they may be having due to the uncertainty of this anaphylactic episode. So all of those things, I'm hoping that as people get more comfortable with and having those tools to practice and to reinforce the knowledge would kind of help solve some of those issues. And I do want to also, actually mention a few people who really been tremendous leaders in this and help embrace this idea. I know it took us almost 3 years to do, so we went through several leaders in the Anaphylaxis Committee and the HIDE Committee, including Dr. Anil Nanda and Teresa Bigaman and Dr. Ruchi Gupta and Dr. Panji, Dr. Jaravala, and yourself, by the way, because I remember us reaching out to you to make sure that this would be well-maintained web-based tool. And Dr. Moore, I believe, was your partner at the time. And we even spoke to Dr. Golden, because when we were developing that tool, the 2023 anaphylaxis practice parameter update wasn't yet published. And we really wanted to make sure that it was compliant, the content was still within the scope of what that document was outlining. And so he was very generous with his time to making sure that that was still within the guidelines. So there was a number of people. We've had stakeholders that included nurses, patients, caregivers, because we really wanted to make sure it was a well-rounded tool that spoke to everybody. And I would be remiss if I didn't mention our amazing AAAAI administrative staff, Laura and Lori and Erin, who really helped us navigate through various stages of the tool and just the process itself. Because again, something new like this, it was just a lot of logistical things that they had to help us work through.
It sounds like a lot of work. It's fascinating, and I love that there were multiple committees that were involved. So you take advantage of expertise from folks who look at things sort of differently. Did you have to obtain like grant funding for this, or was this something that was fully supported through the Academy?
So the Academy did provide us with a grant, which we intend to use for translation services, because we are going to move this into a Spanish version to speak to our Spanish speaking patients and providers. So that is yet to come. I know that we just put out the English version. We'd like to see how it does in practice. We are gathering feedback. There is a survey, an optional survey at the end of the tool upon the exit of the interactive guide. And we hope that we get some responses back. So far, I've looked at some preliminary responses that came in already, about 20 or 25 of them. And so far, it looks really promising. People are very happy with it. So we're hoping that it continues in that vein. And then we hope to develop and build on it, because right now we only have 6 scenarios. It's sort of like a pilot. But we hope to develop additional modules and maybe even slightly different tools, so we have a diverse tools at the fingertips for allergists and other providers to use with their patients.
Who's the target audience for this online course? Who are you trying to reach?
So it's really for the patients, but it's for clinicians to help their patients. So as a clinician, in addition to the handout or education that you're doing in the office, you may want to direct your patients to that tool, and so they can. Especially, like I said, digital natives who are used to this, so they can actually use that to reinforce their knowledge, to reinforce, to practice, with recognizing the symptoms and appropriate treatment. And so that's basically the audience that we're targeting.
Okay. We'll put a link to the site on the landing page for the podcast. But for those who are listening on their devices or things like that, where can people access this information? Where can they find this great tool?
So it's available on the AAAAI's website, and we were really intentional about making this available at no cost to anybody who's interested. So, and the beauty of this tool that it could be used together with the provider on the provider's instructions, or it could be used independently by patients at any time that they feel like they have, the need for it. And of course, we also wanted to use that as an engagement tool. So when you give it to your patient to use, it will help also, if they have any questions in the process, it helps that engagement piece, where they can come back to you with questions and you can clarify and you can, provide additional information.
That's great. So I had the pleasure of going through the course recently, and it's fantastic. But tell us, what can people expect as they take it? Is it just a series of lectures? Is it things that they can read on their own? Or is there a different type of learning format that they can expect?
So this is a series of expert-developed scenarios. We have 6 at the moment, and they take place in different settings. So we try to cover the most common ones, like the home, restaurants, travel, celebratory events, college years. We also try to keep different age groups engaged so that the learner can grow with it. So if somebody's a young, child, they can complete, the caregivers can complete the scenario for that age group. And then as these children, grow and mature, they can then do the older child scenarios. They can do college age. And of course, we have adult as well, especially now that we have more adult onset allergies that we're seeing. So we wanted to make sure we include that age group. And so it's, we really try to touch on different, cultural backgrounds. So we try to touch on different age groups. So we truly within 6 scenarios, you can only do so much. And so, yes, it's not an exhaustive tool, but it's a start, and we're hoping that it would just, be useful and helpful, and then so we can build more in the future.
I took note of the audio that accompanied the written material. I thought that was really nice to actually have somebody read it to you and hear that voice. So that was a nice touch.
Oh yeah, thank you. That was actually one of the AAAAI members who did that. Erin.
Oh,
Yeah.
okay. Well, all right. So in an ideal world, how would you like this, great resource to be implemented into clinical practice by allergists and other clinicians? Is this something that you put the link on a after visit summary, or are there QR codes, or tell us how, we can spread this wide and far?
So right now, this is meant to use after initial diagnosis. So that would be a great opportunity, because when we see patients for the first time, there's so much information, and sometimes they're just so overwhelmed with the diagnosis that the retention may not be the same for knowledge that they're provided. So that would be a great time to give them that tool to practice at a later time. Also, it could be used during the annual follow-up visits. More certainly could be used after anaphylactic events to reinforce the information. So these are some of the points I think that physicians can kind of use to direct patients to the tool. And that again, can the patients, I don't know, I feel like it's really up for interpretation. Like if you feel like you want to use it in office, you could do that too. If you want to, because there is a decision tree where patients can choose to, based on the scenario, to treat it right away or continue monitoring symptoms. And so if they chose latter, it kind of tells you, okay, maybe my patient needs a little bit more education. So as for yourself, you can now see where they're at and understand, all right, do they, where did I go wrong? Maybe I had to give them a little bit more in that area. And so it kind of helps you to understand what the gaps are in their knowledge. And so that do a little bit more in that space.
Yeah, I encourage all of our listeners, go check it out. As Olga mentioned, it's free for everybody. Navigate through the case scenario so you see what it can offer. Think about if and how you want to offer this to your patients as well. Is there anything that we missed in regards to this course, or anaphylaxis for that matter?
No, I think we covered it all. And I do want to thank you for having me on your podcast.
No, it's our pleasure. Dr. Kagan, Olga, we can't thank you enough for taking time out of your schedule to join us. Is there anything else you'd like to add in general?
Well, I just hope to hear back. And so hopefully we'll continue in the same vein to continue educate our patients and bring best we can to the table.
Excellent. Well, thank you again.
Thank you.
We hope you enjoyed listening to today's episode. Please visit www.AAAAI.org for show notes and links to the course from today's conversation. If you like the show, please take a moment to subscribe to our podcast through Apple Podcasts, Amazon, iHeartRadio, or Spotify so you can receive new episodes in the future. Thank you again for listening.